Good morning, and thank you to our stakeholder advisory committees, and welcome to everyone to our day of action. I'm feeling happy to be here together in person. Thank you all for joining us live and live stream. Hello to the more than 500 people who are watching from their computers today. And we'll be hearing, I'm going to excuse our stakeholders to take their seats, and we will be hearing from each of them later in the program as they share with us their priorities for the 2 years ahead. Thank you to our stakeholder committees. I'm Susan DeMarois, Director of the California Department of Aging, and on behalf of our philanthropic partners and the Impact Stakeholder Committee, and together with the Newsom administration, it is my sincere pleasure to welcome you all here today. Today is a long overdue celebration for our community. This event is a major milestone, a major mile marker on our 10-year roadmap for California, taking us to the year 2030. It's a moment that we get to be together, and it's a movement that we celebrate. And thank you all for being a part of it. Let's see. My first honor is to introduce you to our generous philanthropic partners. If you would please stand, I want to acknowledge the generous foundation support that made today possible, made this event possible, and also made the Master Plan for Aging possible. If you are affiliated with any of these foundations, would you please stand? Archstone Foundation. Gary and Mary West Foundation. May and Stanley Smith Charitable Trust. Meta Fund. San Diego Foundation. The Rosalind and Arthur Gilbert Foundation. And the SCAN Foundation. Thank you for your partnership every step of the way, and especially today. Now, it is my pleasure to introduce to you two key stakeholders who represent very important groups. I'm going to start by introducing you to I want to welcome to the stage Dr. Wynnelena Canio. Dr. Canio is a member of the Governor's Alzheimer's Prevention and Preparedness Task Force and a member of the California Health and Human Services Agency Alzheimer's Advisory Committee. Please welcome Dr. Canio.
Thank you, Susan. Good morning. On behalf of the members of the California Governor's Task Force on Alzheimer's Prevention and Preparedness, it is my sincere pleasure to welcome you to the Day of Action. In 2019, Governor Newsom announced the creation of this groundbreaking task force responsible for submitting recommendations on how California can prevent and prepare for the increase in cases of Alzheimer's and other diseases causing dementia. These numbers represent real people, real caregivers, and real stories that I witness daily as a geriatrician and a psychiatrist. My grandma was diagnosed with dementia when I was in college. She started mixing up the stories she has told me growing up. Her doctor gave her medicine and told her that it may or may not help. Over the years, as a family, we suffered ambiguous loss as grandma was losing her ability to cook, move independently, shower on her own, control her bladder, and other losses. As caregivers, we took turns helping her with these increasing disabilities while learning how to communicate in her disease stage appropriate language. One day, as I was helping her with bathing, she cried and said, "Why are you doing this?" "I bathe you." I responded, "You're right. You did, so now it's my turn." When Grandma's paid caregiver moved, my mom decided to retire early to take care of her at home. As emotionally and physically draining it has been, Mom often said, "I'll die before her." I'd give Mom a break, and I'd take Grandma to spend 1 week at a time with us. This was a journey, an added, unexpected career. None of us expected, like every caregiver that comes to my office daily. Never before has this issue been more important. Not only does California have more individuals with dementia, but this population is getting more diverse. The numbers of individuals with Alzheimer's who identify as Latino or Black will triple between 2019 and 2040. And rates among Asian Americans and Pacific Islanders are projected to more than double during the same time frame. As we see in this story, these demographic trends create an urgency to prepare for and respond to the needs of all individuals with dementia and their care partners. The final report of the task force included 10 major recommendations that were included in the master plan for aging. Together, the momentum created a movement to change the course of aging and disability in our great state of California. And we have seen so much progress in just 2 years with action in 9 of the 10 recommendations. Today, as a member of the state's Alzheimer's Disease Advisory Committee, I am honored to see this progress continue. I look forward to hearing from stakeholders, consumers, and state leaders about what we can do together to continue our progress and prepare for a California for all ages and abilities. Thank you.
Thank you very much, Dr. Canio, for all you've contributed to Alzheimer's prevention and preparedness in California, and for your daily practice working with your patients and their families. Your words remind us that we've made tremendous progress and we still have much more to do. Now, please join me in welcoming Dr. Fernando Torres-Gil, a professor of social welfare and public policy at UCLA, an adjunct professor of gerontology at USC, very few people do that, UCLA and USC, and director of the UCLA Center for Policy Research on Aging. Fernando will provide a brief welcome on behalf of the Impact Committee.
Thank you, Susan, and thank you, Wynn, for that eloquent call to action for an issue that will affect all of us, if not already affecting our family and our dear ones. And thank you, Susan, for implying that I am a proud Truan, USC Trojan and UCLA Bruin, and therefore demonstrating my bipartisan nature. Wow, what an amazing turnout. It still is kind of intimidating. There are at least 500 in the room, and many hundred that could not get in but are with us through streaming. So we want to thank all of you, and certainly all that are watching on the streaming, and all of California for coming together on this momentous occasion. And certainly we have so many organizations and the governor's office, the legislature, the nonprofit, the for-profit, all sectors that have a commitment to aging and disability and making California a model state for aging with the quality of life, regardless of our conditions, regardless of our socioeconomic status, regardless of our ethnicity or minority status or sexual orientation, this state is and has to be a model for the rest of the nation. And already many states are emulating what you are doing and what we will all do today. It's been my great honor to be on this journey from the beginning with the Master Plan on Aging. It's hard to believe that it's been 2.5 years since we all came in person. And we haven't seen each other in person since that time. I feel like I'm in a high school reunion, a little awkward. How do I interact with folks? And maybe we should have had photos along with our name tag so we could see what we looked like 3 years ago. I have less hair, a little less mobility, but I hope I'm still recognizable. But this is a journey that you all will play a crucial role today. Those who marched in, those who are here, your counterpart and stakeholders, we have a mission to move forward on this journey. We are about both today and the many issues you will address. And certainly, we have many, many concerns that came out of our master plan on aging that the Impact Committee will ensure will continue to move forward. Certainly, we thank the governor and the legislature for the billions of dollars that have been available to implement many of your recommendations. And so note that it is about action, but also note this. We also have perhaps a once-in-a-generation opportunity to really make a huge impact on how we will age, how we will grow older regardless of our disabilities or our circumstances. And while we look at the many issues you will address and bring forward, certainly we also need to note that we should focus on some few key ones while we move forward to make sure that in the next 2 years, we will come out with some real paradigm-shifting changes. If I had any two, certainly home and community-based care, supporting caregiving, expanding those services. Certainly the issue of homelessness and older adults and persons with disability are now the fastest growing segment of the unhoused, of the homeless population. So let's focus on many issues, focus on as well on a few that we can make a huge impact in the next 2 years. As an academic, I must also say, let's make sure that we have the data, that we have the evidence-based practices, that we can document and validate what we are doing, the problem, but also the progress, also the accomplishments, so that we can prove nationally that what we are doing and the directions we take is making a difference. Certainly, we have many great universities that are our partners and can move forward with us as we work with all other stakeholders. But let me just end with the great opportunity that excites me. Just a short story. When my wife and I drove into a parking lot right across the street from here, and I grabbed one of the very few handicap parking places, and don't get me started on the abuse of handicap placards, that's a whole nother issue. This young parking attendant came up to us to assist us and make sure we paid, of course, which we were happy to do. And she asked me, "Where are you going?" "We have a big conference right across the street." "What is it about?" And I said, "It's about issues of aging and disability." And this young person responded with, "I should be there. It's about my future." And I believe she summed it up. It's about all our futures, but it's also intergenerational. It's also interethnic. It's also interracial. So what we do today is about us, but about the future, and let us always include all diverse populations, but also younger persons, because we want to ensure as they age and hopefully enjoy a good, healthy longevity, that what we do today will make their lives even better. So go forward, folks. Lots of work, but it's exciting, and we have such tremendous potential. It's exciting to be here. Thank you very much.
Thank you, Fernando, for your message of hope and for your lifelong dedication to championing the causes of aging and disability, for being a spokesperson and advocate for yourself and so many others in our state and across our nation. I'm now delighted to welcome our next speaker. Familiar to all of you, a friend, ally, and champion to this audience, my predecessor, Kim McCoy-Wade, Senior Advisor to Governor Newsom on the topics of aging, disability, and Alzheimer's. Welcome, Kim, to the stage.
Oh my goodness, you all keep amazing me. This is even beyond what I could have ever imagined. So thank you, Susan, and congratulations to the entire CDA, Cal HHS, and administration team, and all of you. I'll be brief. I just want to share 3 reflections about what the master plan is, and they've already come to life this morning. It's no accident that it's a day of action. The master plan has always been about those action verbs. We started by engaging. We very quickly moved to embed. We were embedding equity, baking it in. We're launching just January 6, 2021. Who can forget that day? We were launching. We have been called by the Impact Committee to start focusing, and many of us are engaged with implementing. CDSS is buying new housing facilities every day as we speak with their local partners. And Medicaid is rolling out the end of premiums for working disabled, and I'll stop. There's more in your packet. There's a lot rolling out. But that action is so important, and why it's so important you're here today, in person or virtually. Second, the other thing I'd ask you to remember is that the master plan is also deeply rooted in California's history of using master plans at critical moments to build systems. We know the master plan for higher education is why we have the nation leading, the globe leading system of higher education. The master plan can do the same thing for home care and for adult care. That is our charge, that is our history, that's our legacy we're standing on, and we can do that. And as we build that system, we contain those commitments that you're going to hear about all day today. Affordability, California's largest crisis probably. The affordability of housing, making great progress on health care, but the affordability of housing, affording retirement. As Laura Carstensen would say, these bonus years, living to 100, how do we afford them and have them be wonderful, meaningful years of purpose? How do we support family caregivers? A huge priority of our first partner you'll hear from in just a minute. How do we support family caregivers caring for all ages, spouses, loved ones, aging children with disabilities, and so much more? And lastly, how do we protect the most vulnerable? And frankly, all of us are vulnerable from scams, abuse, neglect, but particularly adults with disabilities, with dementia, with behavioral health issues. How do we really stand for all of us, all ages, all abilities? So the third thing I was just going to observe, and as always, Susan and I didn't plan this, but we're right on the same page. To me, the metaphor for master plan these days is music. It is music in the sense that it is a melody, but each of us has our own instrument. Each of us has our own style. See all the dance moves as we came in? Everybody's playing the music a little bit differently, which is what makes it magic. Whether you're thinking about a jazz combo or a choral or a symphony, everyone's got to play their own. Bring what you do. Bring your history, your expertise, your remix to it. But it's also so joyful when we all sing together and so powerful when we all sing together. So please use the master plan as your inspiration, your music, but continue to make it your own. Continue to do it together so we can really raise the roof and just move mountains here in California. So with that, without further ado, I'm delighted to introduce, the governor is out of state today, otherwise I'm sure he would be here, but the governor and the first partner have a few words to help kick off the day, so I will turn it over to them.
California is re-envisioning and redefining aging and disability with our master plan for aging.
But we're doing more than planning. We're also rewriting the narrative on what it means to be a part of the care economy and reminding everyone just how important caregiving and care work are.
Yeah, we've made record progress in almost 2 years since we've launched the Master Plan for Aging, including, by the way, expanding Medi-Cal coverage to all adults over the age of 50, regardless of immigration status.
We've also invested over $20 billion to increase affordable housing, helping California's aging population and multi-generational families have more housing stability.
And additionally, we've invested $2 billion in the care economy, expanding and diversifying California's health and human service workforce so older adults and people with disabilities can receive more quality care at home and in their community.
And California has launched the first in the nation Dementia Care Aware initiative so that dementia screening and care is equitable and culturally responsive.
But truthfully, we could not have done many, perhaps all of these record-breaking investments without each and every one of you.
As with any bold initiative, partnership and collaboration are critical. The bridges built between the public and private sector, between state agencies, local communities, and philanthropy are the reason this extraordinary work is possible.
Yeah, and what we said since day one of the creation and implementation of this plan is that it wasn't just symbolic, that we wanted to make this work matter. And the reality is, in the less than 8 years, just 8 years, 1/4, a quarter of California's population will be 60 or older, changing our economy, our families, and changing the state. And so what we do now, what we do today, will determine how all Californians will live out the rest of their lives.
All California residents deserve a good life, regardless of age and ability, and it is your tremendous efforts that will enable older adults and people with disabilities to live long lives with dignity and purpose.
By the way, we would be remiss if we didn't thank specifically Dr. Ghaly for his extraordinary leadership, as well as, again, expressing gratitude to each and every one of you. Look, the Master Plan for Aging is off, I think, to an incredible start. And through all of your hard work, we're going to continue to transform aging and living with disability in our state.
There's strength in wisdom and in all forms of diversity, and when we come together for the greater good, we all benefit. That spirit of partnership amongst all of you is what makes California a model for the rest of the nation.
So thank you all again for your extraordinary work, tireless and extraordinary work.
Thank you to the governor and the first partner, and Kim as our senior advisor. Would you please convey our appreciation to both of them and let them know they were missed today, and we're so glad that you're with us all day, and we're so proud to have you in this role, working on all of our behalf. We're now going to turn to our keynote speaker, and I'm so excited for all of you to meet Ashton Applewhite. And I'd like to invite Jennie Chin Hansen, please, to come forward. Many of you know Jennie from her long-standing career with OnLock and PACE. She's also past CEO of the American Geriatrics Society and a current board member for SCAN Health Plan, and a personal friend of our keynote speaker. Jennie, welcome.
Thank you, Susan, for again your leadership and the indication of what's to come. We talked about the music that has started our effort, and this parade of hope and promise is an energy that I think we definitely need to capitalize and deploy for our common good. Well, I am very blessed to be at this spot this moment. It turns out not only am I part of your program, but I am an old person in training. And you'll hear a lot more about this, which I'm sure from Ashton. She promotes this along with Dr. Joanne Lynn, who also used this phrase. Joanne is a wonderful geriatrician, has always thought much more broadly. So I'm absolutely delighted that I was invited to introduce my pithy, powerful, and renowned colleague, whom I have had the fortune to meet with in a regular basis remotely over the past couple of years. Most of us gathered here have significant expertise in the content, policy, and skill in giving aging services. I think what is amazing and is important is that we have the fortune to have an activist and thought leader who's not a gerontologist by original training, but she has leaned in a way that has been remarkable, producing the book that many of us are aware of that I'll speak to in a minute. We are fortunate that we have her to take on this domain with a fresh and energized lens. The author of This Chair Rocks, a manifesto against ageism, Ashton Applewhite is a leading spokesperson for the emerging movement to raise awareness of ageism and to dismantle it. A co-founder of the old school anti-ageism clearinghouse, she's been recognized by the New York Times, the New Yorker, National Public Radio, and the American Society on Aging as an expert in ageism. Ashton has written for Harper's, The Guardian, and the New York Times, blogs at This Chair Rocks, and is the voice of, yo, is this ageist? She speaks widely at venues that range from colleges and symposia to the TED main stage and at the United Nations. If you haven't had a chance yet to read her 2016 book, you must do so, seriously. She brings this knowledge, content, the people that she has worked with, Dr. Bob Butler and Dr. Laura Carstensen, who's already mentioned. And it's even better to listen to her book on audio because you hear her direct voice on this. You'll hear her exquisitely lucid and highly researched work in a narrative that is absolutely engaging. Ashton.
Standing ovation for Ashton Applewhite. Thank you so much, Ashton. You are our people, and we are your people, and we're so glad we're together today. Thank you so much for joining us and inspiring us. And I got to start your book last night instead of reading through my notes for today. And I encourage all of you to pick up a copy of Ashton's book in the lobby today. Now it is my pleasure to turn our attention to the incredible work of our 7 stakeholder advisory committees. They have been working diligently over the past years, meeting at least quarterly, more often than that in most cases, to bring forward to this event their priority recommendations for years 3 and 4 of the Master Plan for Aging. We saw them come in together, and now we're going to hear from them individually. And I'm going to start with the Impact Committee. It is my pleasure to call to the stage Andy Imperato, Executive Director. No? Oh, okay. I will start again. It is still my pleasure to call to the stage Andy Imperato, Executive Director of Disability Rights California, and Dr. Sarita Mahanti, President and CEO of the SCAN Foundation. Andy and Sarita will present the recommendations from the Implementing the Master Plan for Aging in California Together, or as we call them, Impact Committee. Andy and Sarita, please come to the stage.
Well, thank you. Good morning, everyone. And it is a pleasure to be here this morning, to stand here with Andy, both of us representing the Impact Committee. I'd just like to remind folks that the Impact Committee was created back in the summer of last year to advise California Health and Human Services Agency on the implementation of the master plan for aging, focusing on accountability, focusing on outcomes, and focusing on continuous improvement towards the plan's 5 bold goals for 2030. And it has been absolutely wonderful to work with our committee, and I want to acknowledge the other individuals on our committee. We have Elizabeth Edgerly from Alzheimer's Association, Nancy McPherson from AARP California, Doug Moore, United Domestic Workers Association, Sharon Nevins from the Department of Aging and Adult Services, San Bernardino County, Kevin Prindeville from Justice and Aging, Kiran Savage Sangwan from California Pan-Ethnic Health Network, and of course Fernando Torres-Gil from UCLA and USC, so thank you. And I would also like to thank, of course, the leadership of that has really that created this committee. From the governor to Dr. Mark Ghaly, Marco Meach, Susan DeMarois, and the California Department of Aging, and Kim McCoy-Wade, of course, senior advisor for aging, disability, and Alzheimer's. And I think what you'll hear today is our recommendations for the next 2 years and the priority setting for the master plan for aging. We thought it was important to focus. And part of when we met as a committee was we found it somewhat challenging, I would say difficult, to do real-time tracking of the action and outcomes across the 100+ initiatives within the master plan blueprint. So the current status of fulfilling these initiatives and realizing the true impact of these initiatives seems somewhat unclear. So we think that a deep focus on a few transformational areas of priority will help ensure that the master plan for aging reaches its full potential. So we go to the next slide. So the first recommendation is about building a system of care. We are seeing time and time again, many are forced to receive their care in institutional settings, like nursing facilities. I saw this firsthand. My own grandmother, who was thriving, fell, went to a nursing home, and ultimately passed in that nursing home, because she couldn't avail herself of the support she needed in her home, in her community. So we really need to build a system that is committed to ensuring that families can afford care at home by expanding Medi-Cal eligibility and creating a new long-term services and supports program, or what we would describe as a social insurance program, especially for those with incomes too high to qualify for Medi-Cal, but too low to cover the current costs of care. We often describe these individuals as the forgotten middle. We need specific investments and improvements to existing HCBS or home and community-based service programs where there are identified gaps or bottlenecks that lead to this downward spiral like I saw with my own grandmother. And we need investments in the workforce that provide home-based care, paid and unpaid. We need to see increasing wages, enhanced training and career ladders, and improving working conditions, particularly for key populations, segments that are already doing this work. We see this with persons of color, immigrants, and women. And I do want to call out that the Justice and Aging has created this outstanding flyer, the Home Care Priorities flyer, that should be at all of your tables. And it also succinctly describes this first area about systems of care on that flyer. So please take a look. So we go to the next slide. It is about ending homelessness for older adults and those with disabilities. Despite the fact that older adults are the fastest growing segment of the homeless population, most of the large housing investments and the allocations were not targeted to older adults and those with disabilities. So we need those targeted funding and specific policies that really also help to establish that interrelatedness between housing and healthcare needs for older adults and those with disability. We also recommend a rental assistance program targeted to those severely rent-burdened and other precariously housed older adults and those with disability. You know, this is, yeah, I agree. This has been evidenced. There's evidence to show that this is one of the most effective homeless prevention strategies. And we do need to make sure when we do this, when we provide this type of assistance, it's coupled with long-term services and supports, that it's coupled with caregiving support. And we need to ensure that these housing establishments are safe for individuals. And if we go to the final slide, evaluate and integrate equity. And we certainly, Impact Committee, applaud the governor for his executive order that came out just in this month that takes action to embed equity analysis in mission, practices, and policies, inclusive workforce, and a racial equity commission. And I cannot underscore enough the importance of our work around addressing racism, and that remains so pervasive in the efforts and our challenges in caring for older adults and those with disabilities. So we want a bold, overarching commitment to advancing racial equity. We want to ensure that those with lived experience in impacted communities guide MPA implementation, and we need to use data to advance health equity. So with that, I want to turn it over, give my partner in crime here, Andy, a chance to offer more breadth and commentary to some of these recommendations. Thank you.
Thank you so much, Sarita. I'm assuming I have very little time, so I'll be very brief. First, I just want to emphasize the T in impact, which is the word together. I had the chance to work on the Stakeholder Advisory Committee for the Master Plan, and in a 30-plus year career doing disability advocacy, I've never seen the aging community and the disability community working as closely together as we did on the Master Plan for Aging. To me, it's a Master Plan for Aging and disability. I very much appreciated the keynote. I appreciate Kim's role in the governor's office keeping these issues together. And I just think it's important in California that we remember the master plan has hundreds of recommendations, and we really need to focus. And that's why the Impact Committee said focus on homelessness, focus on building out a long-term service and supports infrastructure. Let's get those two things done. As Fernando said, we have a generational opportunity to do it. And I just want to remind us of where California is compared to the country on some of these outcomes. We're number 41 in the country in terms of poverty for people 65 plus. So let's focus on that and do better. We're number 41 in the country for voter participation. We are not, for people 65 plus, we are not going to implement the master plan if people don't turn out and vote. So let's do something about that number. 67.6% of people 65 plus vote in California. And we're number 49 in the country for severe housing problems. This is 42% of families that have somebody 62 plus in California have a severe housing problem. So let's focus on those outcomes. Let's move them in the right direction. And thank you so much for having disability at the table. Thank you.
Thank you, Andy and Sarita, for leading off this discussion and for the work of the Impact Committee. I also wanted to make sure that we acknowledge a dignitary who has arrived. Our Secretary of Health and Human Services, Dr. Mark Ghaly, is with us, along with our Undersecretary, Marco Meach, is here too. And one of the, is that the right title? A core value of the Health and Human Services Agency is active listening, and Dr. Ghaly and Marco are both demonstrating that by being with us here this morning so that they can hear all 7 stakeholder committees report out their priorities. Now we will turn to the Alzheimer's Disease and Related Disorders Advisory Committee. Making this presentation will be Catherine Blakemore, retired Executive Director of Disability Rights California, and Meg Barron, Regional Director for the Alzheimer's Association of the Southland area in Southern California. I invite Meg and Catherine to please come to the stage.
Good morning, and thank you, Susan, and everyone else that's here. It's such a terrific event to see the combined efforts of the disability community and the aging communities, and we're really happy to present our set of recommendations. I'd be remiss if I didn't also mention our committee members. I'm the chair of the Alzheimer's and Related Disorders Advisory Committee. We have a really terrific Vice Chair, Derek Lamb, who unexpectedly could not be with us today. And Meg Barron has graciously agreed to help co-present our recommendations. The other members are Dr. Sarah Farias, Pam Montana, Andrea Roberts, Dr. Dolores Thompson, Dr. William Mobley, Barbara McClendon, Tom Shetter, Celine Regalia, and Dr. Wynn Canio, who many of you saw earlier this morning. The committee asked that I start with a well-deserved appreciation for the incredible efforts of the Health and Human Services Agency and all of its departments for its work in implementing the Master Plan for Aging in really what are two watershed years in California. To make the progress that we made in the midst of a pandemic is exciting and says so much about the commitment of this administration. So thank you very much to all of you. And we also realize that in the recommendations, we have ongoing work to do. And my pleasure to present the first two recommendations. The first one, and if you could put, I think there's slides for these, yes. Slides are, the first one is about training and career paths. What we know is that the ability to live in the community of one's choice depends on the availability of staff to provide assistance and supports for individuals. And our recommendation focuses on two different approaches. One is to build on the Dementia Care Aware, which looks at how do we expand training in all healthcare settings about aging, disability, and Alzheimer's in particular. That so from the moment you enter and get healthcare, people are knowledgeable and competent to provide the services that you need. Second, we want to expand career pathways for direct care staff, which for many of us we know are mostly Black and brown women who historically have earned minimum wage or just above. Our specific recommendations are to have required education about dementia, about how to effectively communicate, how does one engage care partners for all healthcare providers. For direct care staff, we want to encourage the ongoing training of all direct care staff to tie the training to career pathways, including opportunities for increased wages and looking at opportunities for community colleges to expand certification and career pathways for individuals in the workforce. Our second recommendation, which Derek was instrumental in developing, is to provide culturally and language competent communications. And we see this as a really critical piece of reducing isolation for people whose preferred language is not English. This will allow us to expand the culturally and linguistic competent services that communities of older adults need for persons with disabilities and family members. It envisions expanding bilingual and bicultural staff and instead of using online translations. It envisions creating an inventory of translated materials and assessing if those materials are culturally and linguistically competent. And it envisions, in partnering with CBOs, creating a registry of culturally and linguistically competent translators who can provide the kinds of services that people whose preferred language is not English can access. So with that, it's my pleasure to turn over for our recommendation number 3 to Meg Barron, who's going to talk about caregiver support.
Hello, everyone. I think all of us in this room can agree that family unpaid caregivers need as much support as we can give them. So our recommendation number 3, support the needs of unpaid family caregivers through a multi-pronged approach of providing financial support, providing training, and increasing investments in and access to respite services. Thank you. The 3 actions: financial support for unpaid caregivers through vehicles such as a tax credit or a long-term service and support benefit that are easily understood and accessible. 2, building both increased access and awareness to evidence-informed, community-based, and state-supported training for unpaid caregivers, as well as expansion of Alzheimer's daycare resource centers with a focus on disproportionately impacted communities of color. And number 3, increased investments to respite services for family caregivers, such as caregiver resource centers, with a focus on providing the service to, again, disproportionately impacted communities of color. Thank you.
Thank you very much, Meg and Catherine, and to the committee members who are here. And a reminder, many of our committee members are live streaming and with us. So hello to all of you who are listening. We will next hear from Dr. Zia Aga, Chief Medical Officer and Executive Vice President of West Health, and David Lindeman, Executive Director of Citrus Health at the University of California, Berkeley. Together, they are representing the California Aging and Disability Research Partnership. Welcome, Dr. Aga and David Lindeman.
Thank you, Susan, for inviting us and for shining a light on the value of research and evaluation as we embark on this amazing master plan for aging. Myself and David are here proud to present to you the recommendations from our committee, the California Aging and Disability Research Partnership. I'll briefly mention the names of our committee members. Some of them are here. Table 17, if they want to stand up and just wave. There we go. But we have, the committee is represented diversely from academic, foundation, and other walks of life. Jasmine Laxman from the Archstone Foundation, Nari Ree from UC Berkeley, Kathleen Wilbur from UC Davis, Heather Young from UC Davis, Leonard Abado from UC Davis, Donna Benton, I see Donna is here, from USC, Isabella Chu from Stanford, Ryan Easterly from the Wyeth Foundation, Steve Hornberg from SDSU, Kathleen Keitzman from UCLA, and Margaret Kushal. So with that set in stage, we have 3 important recommendations that the committee would like to make for the next 2 years of the master plan. As you think about the plan moving into action, and this is the day of action that we're talking about, it's important for us to establish beacons. And we want the state to help establish those beacons that help highlight the importance of the work we're doing, to give us direction, and along with those beacons, have indicators that measure progress towards those beacons. The beacons, of course, become a call to action, so they should be made available to the public. They should be made visible. And those beacons will also guide the research, the data, and the other work that's going to follow. With that recommendation, we also feel that those beacons be person-centered, so they take into account the needs of the person, that they have process indicators along with them, and then, of course, that they have a timeline. An example of a beacon could be, for Goal 1, end homelessness for our senior and disabled population by so-and-so date. And of course, how do you end that? It was through the programs and the 130 initiatives that are underway, and those initiatives are where the drivers will come into play. Our second recommendation is to establish a research consortium. This was called out in the charter of the committee. And the value of the research consortium is to help bring the diverse community of leaders and academics to help us better understand both the needs of this population, but also to better understand how these interventions and the programs that we are developing are having an impact. But beyond that, also to model and tell us what are some of the outcomes and what's the cost to achieve those outcomes so we can prioritize where we invest our dollars. So this consortium has to be put in action, and we have some specific recommendations on that in a little bit. David?
Thank you, Zia, and let me add my thanks to Zia for his leadership in this role, excuse me, and to Sarah Steenhausen and Terry Shaw, who have done a great job of really convening this whole group and bringing us together with state agencies going forward. One of the issues related to recommendation 2 is that we envision several key research initiatives being started as early as possible in this year. If we could go to the next slide, please. So for our final recommendation, of which we condensed a number of areas, we see the importance of setting up core data sets, identifying primary data that is able to track trends across all 5 of the primary areas identified in the Master Plan on Aging. This will take significant work because there are gaps in what we currently have, in addition to building off of existing state resources and other sources from federal and external agencies. We look forward to identifying these because in those gaps, we still have areas that are necessary, particularly around social determinants of health and issues related to all the populations and subgroups that we're looking forward to tracking. Finally, in this regard, we feel it's important to build out a complete research function that is a combination of what can be done with the department, and we call out the leadership and thank again Susan's team for now focusing on pulling together even greater research going forward, the idea that we can track and evaluate different programs, and the fact that we can now identify those sources in a very systematic way so that we can track the Master Plan on Aging into the future. Final slide, please. So we have a work plan that we've put forward, fundamentally based on hearing from the department, from the agency, and once final priorities are set, that we can identify different research areas going forward from the informational structure of bringing individuals together, but also to identify the data sources so that we'll be able to start in this area very quickly. Let me turn it back to Zia for a wrap-up of this specific area. Thank you.
Thank you, David. I do want to definitely call out and support the investments the state is making already with the launch of OMI. I know that Sarah and her shop is hiring a research director and bringing in those resources within the state to really partner with the academic community and others to power this work. So really, really, really important to do that, to build those infrastructure and capabilities. And as we move forward in partnership with our partners, we hope that we can identify and launch in the near term 2 to 3 high-value research projects that help identify that focus. We've heard the word focus today. We have to start somewhere. Let's find those 2 to 3 big areas. Let's go after them in the next 2 years. There are ways to provide some of that funding through state and public-private partnerships. We are confident we can pull that together. And we hope that next time we meet in 2 years, hopefully we will have some real data some real evidence to show that the work we are doing with the master plan is having an impact on behalf of the seniors and the disabled community that we're all here to serve. Thank you so much.
Thank you, David and Zia. You can't tell from their slides, but this committee was just formed this spring, so they've achieved all of that since April, I think. Next, I'd like to invite up to the stage two presenters from the California Commission on Aging. Carol Schwartzlander is the Executive Director of the Commission, and Ellen Schmeeding is the Chair of the California Commission on Aging and Vice President and Chief Operating Officer at St. Paul's Senior Services in San Diego. Welcome, Carol and Ellen.
Thank you so much. It's such an honor for us to be here today. Let me tell you a little bit about the California Commission. The Commission on Aging is honored to be part of this extraordinary event as California collectively works to achieve an age and disability-friendly state and address systemic racism, ageism, ableism, and bias. The Commission's mission is to serve as the principal advocacy body for older Californians and a catalyst for change that supports and celebrates all Californians as we age. The Commission is established in state statute as an independent advisory body and principal advocate before the governor, the legislature, and state and federal agencies on behalf of California's older adults. And I would just like to recognize many of our 18 commissioners are here today, and I'd like to ask them to stand. You saw them dancing in, now they can dance at their tables. They represent individuals from throughout this great state and help us to make sure we fulfill our mission. Our top three priorities address older adult behavioral health, workforce development, and housing and homelessness. You've heard these themes and you're going to hear them again. Please advance to the next slide. Our first recommendation, improve behavioral health services for older adults. Behavioral health includes both mental health and/or substance abuse issues. In California, older adults are unserved and underserved relative to their needs. For example, in 2020, we had almost 27,000 older adults who received any type of behavioral health services, even though the data projects for us that at least 700,000 older people need services. Access to behavioral health is even more urgent in underserved communities, such as communities of color, LGBTQ, and other marginalized groups. Of course, the pandemic shined a light on the negative impacts of loneliness and social isolation among older adults. So how can we take action on this recommendation? Number one, ensure older adult representation on state and local advisory boards, such as the Behavioral Health Task Force under the Health and Human Services Agency and the Mental Health Services Oversight and Accountability Commission, as well as at the local level on behavioral health boards and commissions. Establish leadership positions with older adult behavioral health expertise at both the state and the local government levels. We feel it is critical to establish an executive position with older adult behavioral health expertise at the California Department of Healthcare Services to help us address the current inequities in inclusiveness, planning, outreach, and service delivery for older adults. And we'd like to leverage the expansion of the newly formed geriatric emergency departments that are springing up not just in San Diego, but throughout the state and nation to collect data on older adult behavioral health needs and access to services. And finally, to collect standardized data that includes older adult behavioral health, racial, ethnic, and sexual orientation and gender identity, SOGI data, and ensure that that is captured in the next data dashboard. And now, please advance to the next slide.
Our second recommendation is to expand the workforce that serves older adults and to also increase workforce opportunities for older adults. California's health and behavioral health and human services workforce is insufficient to meet the needs of a growing and diverse aging population. Understaffing and inadequate geriatric and behavioral health training are challenges across the state. We are now just 3 months shy of 7 years until 2030. That happens to be the year when the oldest baby boomers turn 85, which is also the age at which most individuals utilize the most long-term services and supports. Our first strategy is to leverage current workforce initiatives to encourage specialization in geriatrics and gerontology, such as the $1.7 billion workforce investment currently ongoing, and the Mental Health Services Act Workforce Education and Training Program. We should recruit and support individuals from underrepresented regions and backgrounds to create a more diverse, representative, and culturally inclusive workforce. Third, we should streamline access to employment programs that support older adults. Let's help older adults retain current employment or re-enter the workforce through training and providing assistive technology, devices, and living supports through coordination at the state and local levels. For example, the Senior Community Services Employment Program under the Department of Aging, breaking barriers to employment and high-road training partnerships under the California Workforce Development Board, and vocational rehabilitation and independent living skills services provided by the Department of Rehabilitation. And finally, we should incentivize businesses to provide accommodations for older adults and individuals with disabilities, such as flexible part-time work schedules, parking arrangements, and assistive devices. One example is the Department of Rehabilitation's Employability Business Grants program that helps businesses introduce and expand disability-inclusive hiring practices. Next slide.
Our recommendation number 3 is to address older adult homelessness and increase housing options for older adults. You will hear this theme over and over today as one of our most crucial. When I was taking my walk this morning, I counted 5 older adults who were obviously homeless just right around the Capitol and the hotel where I'm staying. Older adults are the fastest growing age group experiencing homelessness in California. Older adults may be newly homeless, or they may have become older adults while living for years on the streets. Regardless, chronically homeless older adults often have critical health and social service needs, in addition to their obvious housing needs. So what are our action steps that we're recommending? We have one in particular we want to share with you. We want to see expanding the residential care facilities for the elderly to allow more than 6 beds if the home has adequate space for more by amending Health and Safety Code. We estimate this amendment could quickly add an additional 7,000 beds in RCFEs across the state. This recommendation also aligns with the Community Care Expansion, Capital Expansion Grant Program under Department of Social Services to create more residential care options. We would also like to see state funding to support expansion of home sharing programs and advocate for the removal of barriers such as those with SSI and federal housing and urban development housing that impede home sharing opportunities for low-income older adults. And our final recommendation is to expand the program for all-inclusive care for the elderly, or PACE, including finding a way to finally serve middle-income individuals in that program.
So the Commission firmly believes that prioritizing these recommendations and strategies will improve the lives of all older Californians, promote equity and inclusion, and reduce disparities of underserved communities. So in closing, we want you to know the Commission stands ready to work with all of you to achieve this, because we know the actions that we take in the next 2 years and the systems we establish to implement the master plan will impact the lives not only of older adults and individuals with disabilities, but those that love them. Thank you.
Thank you, Ellen and Carol, and to all of the commissioners who are here and who met yesterday and were joined by Secretary Ghaly at their meeting. We have heard now from 4 of 7 stakeholder groups. The next group that we will hear from is DACLAC. DACLAC, the Disability and Aging Community Living Advisory Committee, and we have two spokespersons, Debbie Toth, President and CEO for Choice in Aging, and Patty Prunehuber, Director of Housing Advocacy at Justice and Aging. We are excited to hear from Patty and Debbie, who I know is here also. Debbie. We'll start with Patty.
Thank you. Thank you so much, Susan. This is a great turnout. Are there any California aging and disability advocates in the house? Woo! My name is Patty Prunehuber. I am the Director of Housing Advocacy at Justice and Aging. We are working to address older adult housing instability and the increase in older adult homelessness, and to ensure that every Californian is able to live in inclusive communities that are affordable, age-friendly, disability-friendly, and equitable for all. And if that sounds like familiar language, it is the Master Plan for Aging goal number 2. I am also with Eric Harris, the co-chair of the Disability, Aging, and Community Living Advisory Committee, fondly known as DACLAC. And for those of you who don't know DACLAC, it began in the wake of the Olmstead Supreme Court decision in 1999 that said that people with disabilities had the right to live in the most integrated community-based setting possible, and that we should provide the services and supports to make that happen. So I'd like, there are over 40 stakeholders that are part of DACLAC, and many of you are here today. If you could raise your hand if you are part of DACLAC. And we also have tremendous representation from the administration, from the agencies that support DACLAC, and from legislative staff. So DACLAC's mission is to advance community living, inclusion, and integration across California. It is rooted not only in the Olmstead Supreme Court decision, but in California's values of inclusion, access, and equity, and in the Master Plan for Aging. Yet we know that we still have a lot of work to do to ensure that people are not unnecessarily placed or kept in institutional settings because they lack the housing, the home care, and the integrated supports they need to live fully in their communities. DACLAC endorses those Master Plan for Aging recommendations that will allow older adults and people with disabilities to live and age in their communities. And the two recommendations that you have heard so many times this morning, and I'm going to echo, are targeted funding and specific policies to address the interrelated housing and healthcare needs of people with disabilities and people who are aging. And that home care system must be complemented with investing in a rental assistance program targeted to severely rent-burdened and other precariously housed older adults and persons with disabilities. It's really quite simple. Keep people in the housing that they already have. So let's do it. We need to invest now in a robust system of at-home care and in affordable, accessible housing. Because without a home, there is no home and community-based services. We also know that housing and homelessness is a racial justice issue, and our solutions must intentionally advance equity, allowing all Californians to lead full, independent, and dignified lives. So there is a specific goal around ending and preventing older adult homelessness in the Master Plan for Aging. You'll find it at initiative number 117 if you're looking. And what we know is that California's lowest income older renters are being squeezed out of the rental market. Rapidly rising rents are leaving them one crisis or rent increase away from eviction and homelessness. In California, we had rent increases exceeding 15% since the pandemic began, and we know that people's fixed income hasn't risen at nearly that rate. As you've heard, older adults are the fastest growing age group experiencing homelessness in California, and almost 1/2 entering homelessness for the first time after age 50. With Black older Californians 4 to 5 times more likely to face the risk of becoming homeless. If you look at the great CDA and I'll never get the name right, the Interagency Council on Homelessness data dashboard, you'll see that the number of individuals who have needed to access homeless services from 2017 to 2021 more than doubled. It grew 138% for people aged 65 and over. And that means over 15,000 people in that age category and over 40,000 people in the 55 to 64 age category. DACLAC has a housing subcommittee, and that subcommittee, the MPA Impact Committee, more than 35 organizations that supported a targeted rent bill called AB 2547 in the last legislative session, are all committed to furthering that MPA goal of ensuring community living and ending older adult homelessness by investing in this rental assistance program that is specifically targeted to older adults and people with disabilities at the highest risk of becoming homeless. And it also uses some novel ways of partnering with aging organizations and stakeholders and community-based organizations to ensure that we are reaching older adults and people with disabilities and pairing the services they need to enjoy community living. We look forward to partnering with you, the governor, the administration, and the legislature to fulfill our promise that we have made to end older adult homelessness. And could I have the next slide? Where is my partner in crime, Debbie Toth?
Right behind you.
Oh, great. Thank you so much.
I snuck in. My apologies.
Probably want to go to the next slide, actually.
I probably want to go to the next slide, actually.
Yeah.
Okay. I want to go to the next slide, actually. Hi, everybody. I want to take, I'm going to go off script a little and ask everybody to either stand or stretch or smack the person next to you, do something that makes you feel a little different and good for a moment. Unless they're a really nice person, don't do that. Just a love pat, yeah. Because this is a little bit long, right? Listening to all the glorious things that we're going to do to revolutionize the state of California. And it's hard work just sitting and listening and absorbing all the things. And it's also interesting to note how much synergy there is between, because we didn't plan it. We didn't like call each other up and go, hey, what are you guys talking about for your 3 priorities? So it's interesting to hear, and I don't know if you guys are hearing the theme of interdependence, intergenerational, interdisciplinary, inter. So it seems I'm hearing this theme about that. Thank you, everybody, for indulging me, and I hope nobody got hurt in the process of being smacked. So here we go. Congratulations. Today is your day. You're off to great places. You're off and away. You have brains in your head. You have feet in your shoes. You can steer yourself any direction you choose. You're on your own, and you know what you know, and you are the guy who will decide where to go. Unless you don't have accessible transportation. Then you won't. Then all this work we're doing to create a California for all becomes a California for some. And that just won't do. Dr. Seuss would definitely not approve of a book called Oh, the Places You Can't Go. But that is exactly the reality for many people living in our great state who are aging and/or who have disabilities. So that's why accessible transportation rises to the top of our priorities at DACLAC, which also rhymes with AFLAC. Yay! That's one of the many reasons we're the best committee, but I'm not competitive. However, if you have a roof over your head, but you can't get to the grocery store, or your physician's office, or your friend's house, or your job, well, then what good is that housing? Transportation is the glue that holds all of the rest of the master plan together. We're banking on you sharing this radical notion with us. Hold for it, it's radical. All people should be able to get where they want to go when they want to get there. Wait, what? That's crazy. Did I just say that? I mean, it's just plain nutty that people should get where they need to go. So let's talk about what that looks like for a minute. Fortunately, we have legislation from 1979 called the Social Services Transportation Improvement Act, which is way too long for any act, but it is. And it lays out the vehicle for us, and yes, the pun was intended, and it just needs two things. It needs some modernizing, and it needs some funding. And that is what we intend to do in partnership with writers, providers, advocates. How many advocates in the room? Any? Just a couple. And what's different now than the last 30 years that we've been trying to have this conversation is that partnership, I'm going to start again, is with writers, providers, advocates. Here's the and. Our state partners at Caltrans, CalSTA, and the Transportation Commission. What? Kim McCoy Wade, I had to find her, sorry, is the reason that we are in this moment. Not the only reason, but I will say an important reason that we're in this moment, because she gave us the microphone to say that our work on the Stakeholder Advisory Committee that went into the master plan, the transportation piece, there was like a little trap door and it fell right out the bottom. And she gave us the microphone and said, tell us what happened and tell us who you need. And now we have a transportation subcommittee of DACLAC that rhymes with AFLAC, so you don't forget it, DACLAC. And on that transportation subcommittee, those 3 state agencies are engaged, presenting, learning, and teaching. So it's a new day. So I just want to say, imagine a world where people who use a system design it. I know we're getting radical again, but this will work. And we will take the lived experience of writers and accessible transit providers and create something akin to a disability and aging resource connection from the perspective that there's a single point of entry, no wrong door, one eligibility screening, an education of available options, and a warm connection to rides. And not just that, but the ability to design the system based on local need and have it funded. It's that simple. Let's fund accessible transportation the way we fund streets, roads, bridges, paths, and every other aspect of transportation. Okay, I'm going to go to the next slide, but I want to give a shout out to Contra Costa. Everybody here from Contra Costa, raise your hands. Contra Costa all over the room, because we are kicking butt in accessible transport. Oh, sorry. At least I didn't say the A word, right? Okay. And now on to CalAIM. Do we have the right slide? We do. All right. So you know that massive, dreamy overhaul and redesign of the Medi-Cal healthcare delivery system that we've all been hearing about. And it addresses not just the condition that someone has, but the factors that contribute to it. Those factors are called social determinants of health. And they include things like, wait for it, accessible transportation. Yeah. And other things like where you live, whether you have access to education, your ethnic background, that whole racism thing that we keep talking about, hearing about, and reading about and living. Yeah, that. And there's so much more. But it actually looks at all of the things that together create a person's health. And why are we so excited about this CalAIM thing? because its success relies on home and community-based services. Without those supports, people cannot live and thrive in the community. Our home and community-based services are experts at meeting people where they are, designing services with dignity and honoring the wishes of those we serve. How we provide transportation, home care, meal delivery, adult day services, care management, education, and so much more is tailored by the people we serve. The language, the design, the community, all of these in which we deliver the services matter and guide our work. And in terms of what people need, we adapt and live to find it and to help support it. And so there's a really organic and cocoony aspect to what we do. And this is new for some of those CalAIM health plans. So we're here to help, but also to make sure we learn about what works and what doesn't in real time. So we had a little snafu with CCI, that initiative that brought together Medi-Cal and managed care. I'm getting the 2-minute warning, everybody. But we had a little snafu. We learned after we rolled out CCI, this integrated product with a great intention, that there were some problems and there wasn't utilization by the health plans of these long-term supports and service benefits. And we learned it after the fact. So let's not make that mistake again. So I can just tell you as a CBAS provider, contracting even 10 years after working with Medi-Cal managed care is still not easy. So we have some work to do around this, and it's vital that we work together with eyes wide open, that we create an early warning system locally and at the state level so that we can adapt as we go and we can fix things in real time. We need a way for consumers, community-based service providers, and caregivers. I'm going to repeat that. Consumers, community-based providers, and caregivers need to be able to give feedback and get feedback in real time so we don't run into access issues. This will optimize success. We're in a new universe, ladies and gentlemen, where we recognize that all people deserve to live with dignity in their setting of choice, and that is what we aim to achieve with DACLAC, rhymes with AFLAC, leading these vital priority areas, a true California for all. And I would be remiss if I did not point out to you the sticker that I have upon my chest that is LTSS. It comes in concert with the handout that's on your desk done by the Stakeholder Advisory Committee, and there's also in the center of your table little yellow cards, and I really, really, really want you to write your feedback so that the state can incorporate it into all they're doing. Thank you and have a great rest of your day.
Thank you, Debbie and Patty. And I wanted to call all of your attention, and I appreciate the 5 committees thus far that have credited the governor and the administration and the legislature for the incredible progress we've made in the past 2 years. There is a QR code on your name badge that links you to the hub, and on the hub you will find a fact sheet that summarizes the key investments and initiatives that have been made in all 5 goal areas. So I urge you to visit the hub while you're here today. Now I'm going to introduce to you our next committee. I'm pleased to invite up Eric Dowdy, Vice President, Public Policy for the Alzheimer's Association, and Vivian Mabaku, Director of Equity and Elder Justice with Justice and Aging. Together, Eric and Vivian represent the Elder and Disability Justice Coordinating Council. Welcome.
Thank you, Susan, and thank you, everyone. It's really tough to go after Debbie Toth, so it may be a little dry. I have no Dr. Seuss to share with you, but we will get through this. So I'm Eric Dowdy. I'm with the Alzheimer's Association. I am pleased to co-chair the Elder and Disability Justice Coordinating Council. We have about 30 members strong. We're sitting generally in that side of the room. So thank you everyone for your tremendous work on our 3 recommendations. A lot of great progress. So I will present our first 2 and then turn it over to my colleague behind me. If we can have the first slide. Our first recommendation is to fully fund adult protective services to improve the delivery and coordination of services, training opportunities, and incentives to work in the APS field, right? This includes improving the delivery of services by ensuring sufficient staff are hired. We have a staffing crisis there as well. Using accepted APS caseload standards. Also improving the coordination of services, implementing and expanding collaborative case reviews with stakeholders, improving equity among programs across the state and within communities, providing up-to-date training opportunities and routinely review and identify emerging issues, and then providing student loan forgiveness grants as an incentive to be in the field. So that's our first recommendation. Second slide, please. Second recommendation is to fully fund the public guardian and public conservator programs, create a state unit responsible for oversight as well as fund allocation and data collection. This includes increasing public guardian and public conservator funding, establishing a home within the State Department of Social Services for the public administration, public guardian, and public conservator through a new office of we'll get the acronym PAPGPC. Tasking this state entity with data collection. We have a data deficit. And then also consider adopting the WINGS model, known as Working Interagency Network of Stakeholders that engages stakeholders in improving their state's judicial processes, protecting individual rights, and addressing funding and ensuring guardian accountability and standards. So those are our first two recommendations with a little meat behind it. I'd also like to turn it over to Vivian Mbaku with Justice and Aging for our final recommendation around legal services.
Thank you, Eric. Okay, so our last recommendation is to publicize and fund legal aid services. And that really includes increasing the understanding and availability of legal aid programs, and then also adopting restorative justice models where appropriate and improving data collection. So throughout California, we know that legal aid agencies provide high quality, free legal representation to thousands of older adults and adults living with disabilities each year, but access to these services is really hindered by funding and outreach limitations, and that's especially for marginalized communities and those living in rural areas here in California. So we really recommend increasing outreach to disenfranchised communities and increasing the capacity of legal aid organizations to serve more clients. In addition, legal aid orgs need more funding to increase services in estate planning and homeowner protection. In conjunction with increased funding, we also need to improve data collection to better demonstrate the impact of the legal interventions in terms of outcomes, impact, disparities in access, and unmet needs and trends. We also recommend creating stronger referral networks through the California Bar Association to provide older adults access to competent civil attorneys who are trained in elder law and financial abuse, and in connection with that, encouraging more attorneys to get involved in elder abuse and elder law cases and increase their knowledge of those areas of law. In the realm of criminal law, we recommend that criminal prosecution of commercial predators be prioritized and additional training for prosecutors to allow them to address issues that may arise in working with older adults and adults with disabilities. And we also recommend that the state really start exploring restorative justice approaches to elder abuse, and so that it's a potential strategy in appropriate criminal cases. And finally, we recommend the reestablishment of elder courts, which provide a central point of coordination for complex cases that cut across several practice areas and needs inside and outside the court system. I would really like to thank everyone on our committee. We have a small group sitting over here, but a lot of our committee is actually on other committees. They're very engaged people. So I just want to thank everyone for all of the work that we've been doing on the Elder and Disability Justice Coordinating Council. We've gotten a lot of work done so far. We've also established our own equity principles that will guide our work going forward, and we're really proud that we have made a commitment to increasing equity and focusing on equity in all of the recommendations and all the work that we're going to be doing going forward in the year. And I think I can speak for everyone here that we really look forward to collaborating with the other committees after all of these presentations. It's really clear that there is a lot of overlap in our individual priorities as individual committees and groups. And I think that there is an opportunity to really work smarter, not harder, because we're all really, pushing towards the same goals. So I think that our committee and the other ones, hopefully we can all collaborate together in the future. Thank you.
Thank you, Vivian and Eric, and all the members of the Elder and Disability Justice Coordinating Council. We have one committee remaining, and then we will move to our panel with Secretary Ghaly, representatives from the Housing Agency and our state legislature, and then we will break for lunch for anyone who's checking the time. We have saved, not in order of priority, but the Equity and Aging Advisory Committee was actually the first committee that was formed. The governor's executive order called for a stakeholder advisory committee and an LTSS subcommittee and a research committee, but the wisdom of the group quickly concluded we needed an equity advisory group, and that was formed within the first few months of the Master Plan for Aging process, and we're so proud that their work continues. I'd like to invite up Jennie Chan, Managing Director of Equity Advocacy at Justice and Aging, and Rigo Saborio, Vice President of Program, Equity, and Community Impact with the SCAN Foundation, to bring forward the recommendations of the Equity in Aging Advisory Committee.
All right, good morning, everyone. It is hard to go last, so we'll try to make this short and sweet. My name is Jennie Chan. I'm the Managing Director for Equity Advocacy at Justice and Aging, and I have the privilege of co-presenting with Rigo Saborio. We are presenting our top 3 recommendations on behalf of the Equity and Aging Advisory Committee. I first want to give a big thank you to the California Department of Aging for putting this event together. It has been the first time that our committee has been able to meet in person, and the joy of seeing people in person and being together as opposed to watching squares on a Zoom is really, really quite energizing. So thank you for all your hard work in putting today together. I don't have a complete list of people on our committee, but in the interest of time, I just want to say if you are on the subcommittee, please raise your hand, and if we can give you just a shout out, thank you for your hard work. So as you can imagine, the Equity and Aging Advisory Committee is composed of a diverse group of stakeholders with lots of passion and interests in lots of different communities. So when we were tasked to put together only 3 recommendations for years 3 and 4, we were faced with quite a challenge. So what I'm going to focus on, if we can pull up the first slide, is our first recommendation, which is our threshold recommendation, and ultimately is both a process recommendation as well as a goal, which is to embed equity throughout the implementation process. For all future initiatives in years 3 and 4, we want the state to identify the inequities being addressed and how each initiative will improve those inequities and for which older adults and which people with disabilities. The reason why this recommendation is threshold for us and so critical is because of a couple of different reasons. One, we know that we can't make assumptions about all the initiatives improving all sorts of equity. We know that we have to be super specific. And we know that if we don't bake it in from the beginning, it will get lost behind us. We can't leave equity up to discretion. We know that it has to be baked in throughout. And we know across the country we are witnessing the pendulum, as Rigo and I talk about quite often, shift. We are not in a moment of extreme racial reckoning anymore. This is not 2020. People's appetite for equity is perhaps shorter than it was a couple of years ago. So in order to safeguard equity and make sure that California's master plan for aging remains key in terms of advancing equity for all Californians of all ages and disability and abilities. We want to make sure that it is built directly into the process for all the reasons that Ashton's wonderful keynote this morning explained why these inequities compound. We think that this is critical in terms of our recommendations for years 3 and 4. I'm going to pass it over to Rigo to go over our second and third recommendation. Thank you.
Good morning, all. It's a pleasure to be here. I am thrilled to be here. As we go back a few years, and I'm, talking to Kim, and with the formation and her leadership around the MPA, and we talked about the need for making sure that equity is embedded through this work. And as she mentioned, thrilled to see that it's truly, baked in and not sprinkled on, as our good colleague Cheryl Brown often noted to us. So it's a thrill, and I'm really see to the evolution of this equity journey as it has played out. And because if we heard the reports from all these 6 other committees, we heard loud and clear how equity is truly embedded through their plans, and really excited to see that evolution. And I know I'll be brief in sharing the other 2 recommendations because I am what's standing before Secretary Ghaly, and so I don't want to hold on too long for that. But so building on that, the committee, the advisory committee, also made a couple of recommendations. And one is to ensure access to culturally appropriate in-home care. We want to ensure that services are expanded so that equitable LTSS is accessible for all communities facing, particularly those that have been, facing historical and present-day discrimination. We want to work to increase and diversify the healthcare workforce to better reflect the communities it serves. And of course, and we've heard this throughout other committees as well, that we must collect and utilize data with metrics along race, ethnicity, gender, SOGI, and disability, so that we can have a better understanding of the unique needs and develop an appropriately targeted solutions in addressing the issues. And also, our third recommendation we want to raise is caregiving for people at home. And we want to raise this as a top priority. That support family caregivers, predominantly women who are working and spending out-of-pocket, quite a bit out-of-pocket on care. We want to ensure family caregiving assessments and are executed and track specific equity needs. And as a final recommendation, we want to expand respite care and track access and utilization among various communities, especially among Black and Latino caregivers who are less likely to use respite care, though have more hours of care and provide more complex care than non-ethnic caregivers. So in closing, I'd like to say that we look forward to working with one and all to assure that the equity plan recommendations that we've expressed today truly go from plan to reality. Thank you.
Thank you, Jennie and Rigo. And thank you to all 7 stakeholder advisory committees and to all of the people who served on any of the Master Plan for Aging advisory committees or work groups. If you have participated in this process to date, would you please stand so we can give you a warm round of applause to all of our stakeholders. The genius of California's Master Plan for Aging, and we hear often we don't want it to be a report that sits on the shelf, is we have these 7 stakeholder committees and more. You heard from the Commission on Aging about the work in behavioral health. You heard about the Interagency Council on Homelessness. There are many paths to influence the Master Plan for Aging in coming years. And if you have cards on your table, if you're interested in learning more about any of the stakeholder committees and you would like to serve, we will be switching up membership over time, so we always welcome new additions to our stakeholder advisory committees. So thank you all for your contributions. I think that we have had thousands upon thousands of volunteer hours from our stakeholders throughout the state on webinars, phone calls, Zoom meetings, and here today. So we greatly appreciate your many contributions. Now we don't have a break. This is probably when you're thinking, here's when the break happens. There is no break. and that's sort of the nature of the master plan for aging, and the work that we have ahead of us is we're just gonna press on. So I would like to encourage all of you to stand up and stretch. We're going to have a natural break right before the lunch. If anybody does need to leave the room, please come back and join us. I'd like to invite Secretary Ghaly to come to the stage. He's going to lead the next panel. Dr. Arambula, I know, is here with us. I don't know if Senator Pan has yet arrived, or Melinda Grant from the Business Consumer Housing Agency is with us. We're going to assemble our next panel while you all just stretch in place, and we'll get situated here for the closing program before the lunch.
Is this on? It is. Good almost afternoon, folks. Can I have you take your seats? I want to get started with our panel, so we are not the reason your lunch is delayed. Thank you. Okay, just a few more seconds, give people a chance to get to their seats. Great. So really, what a pleasure to be here, I have to say. When you come to the convention center, you're never quite sure which room a group is taking over. You wonder, is it the small ones with a lot of dividers? Is it the medium-sized ones, or is it the really big one? And we all should be proud at the number of people here in person, 500 plus people online. Really a tremendous statement about what a day of action looks like. And I'm really proud to be here joining you for that. So with that, just one big round of applause for this tremendous outpouring. And you're not here to celebrate what we've done, although that's important. It's really about looking forward. And I know, as the Secretary of Health and Human Services, many members of my team at agency, many leaders of departments that can make a difference here, we are listening actively to what happened today. And I'm really just having listened to the stakeholder groups present a commitment for what we need to focus on over the next 3 years is heartening. None of it is frankly surprising, which is what is so tremendous about the movement that started. I remember coming into this role, and many of you know, I'm a card-carrying pediatrician, deeply care about issues for children, but immediately learned, embraced, and really count myself as lucky to be part of the team that's trying to move forward issues for individuals with disabilities and aging Californians. There's a number of people that I feel compelled to thank for both instilling in me the focus and tenacity to support all of you in that work. Kim McCoy-Wade, can't be said enough what you did to really catapult this work forward. Marco Meach, Undersecretary at HHS. This has been on his radar. Yeah, Marco deserves some real shout out because of the work that he's done to not just really keep this on the front burner, but to innovate it, to really come up with the approach, the campaign. To the 7
philanthropic groups that came together, grew together, supported this movement in a way that showed this isn't just about what happens in Sacramento or what happens in LA or San Diego or MODOC. It's really about what all of us are going to do to make sure that every recommendation is taken seriously and that we put everything we can into making sure that it's invested in. So Marco, Kim, Susan, I can't thank you enough for really coming into a role and taking, as they say, the bull by its horns and really working hard to keep moving this work that is so critical. And you can go on and on and on, and I need to end by thanking the governor. I was with a group of about 15 secretaries of Health and Human Services from across the nation just a couple of weeks ago. And they were going around and sort of sharing what each was envious about the other states represented. And this was the issue that so many other states were hearing from their own stakeholder groups that we are doing in California so well, with the force of all of you behind it. And the thing they said separated California apart started before the election, right? It was the fact that you as groups were strategic and advocated for candidates for governor of California to be focused on this issue. And thankfully, in Governor Gavin Newsom, we have not just a pragmatic supporter, somebody who's going to continue to listen to his team, to listen to all of you as we move these issues forward. I'm really proud to be part of that team and just thank all the people who made this possible. Before I introduce the panelists, which I'm excited to moderate this panel, I want to just also say that what I heard from the stakeholder groups resonates deeply. I appreciated the time that I had yesterday with some of you, today, hearing about the anchor in equity, that this is about an equity-first movement, that that's how we make sure that the aging issues over here and the disabilities issues over here actually get deeply connected, intertwined, baked together. I think that that's a really important thing to elevate. I'm proud of what the governor has put forward with the executive order on equity. I'm also really proud that our agency, with some of the tremendous leadership of our department directors, has already been on the front line of equity, whether it was because of the pandemic or well before for some of us. I think we recognize this tremendous opportunity to not just pay lip service to it. What I'm excited about for our agency is how do we stop talking about equity, but how do we actually live it at every table that we convene? How do we actually invite those who represent all of California to convene those tables in very different ways? And it's not just about inclusion, it's about belonging as well. This idea that we don't want to just set tables where people can have a voice and then they wonder if it was ever integrated in the plan, but that they actually feel like they're part of it in a way that isn't in a way a membership to the policy making, the program development, its evaluation, and hopefully its improvement. So look forward to that. Things I heard this morning: behavioral health, behavioral health, behavioral health, housing, homelessness, right? And workforce. So these are things that we can make a move on. You have people at on the panel who deeply care about those things as well. They have ideas, they've been leaders in this work. And I think with the strength of both the administration, the legislature, and when I say administration, it's not just HHS. It's departments, agencies far and wide that make a difference. You heard from Debbie about the transportation and the fact that there's a table set with transportation players at the table, both listening and learning, and hopefully, and I expect, I know Kim, you do, the governor does, implementing some of those ideas into the work. So I think a really exciting time. And I'll end by saying a day of action feels really incomplete without a day of alignment. And the fact that there's so much alignment in this room, not surprising, not by accident, only because of the hard work of all of you for weeks, months, years before today, that this day of action not only feels real, but really instills a ton of hope in all of us that it's going to make a difference moving forward. So without further ado, I want to just take a moment. From here, I'll take a seat in a second and just introduce the three panelists that we have today. So first, Secretary Lourdes Castro Ramirez sends her regrets. She wasn't able to make it, but I am really happy that she sent her Undersecretary, Melinda Grant, who you're going to hear from in a moment. I will say, just by introduction, when we started the cabinet work group for the Master Plan for Aging, remember there was a whole stakeholder project, but there was also a cabinet work group that was developed. Kim and I talked about it. I had the privilege of leading it. Melinda was there, and Melinda was like the first hand up to talk about her experience, her story, and I know she's going to share that again today, because today is about listening and making this personal, and she's going to do that. Senator Richard Pan from Sacramento has been an amazing leader in our Senate and just in issues around health and human services for such a long time. Richard, really, Dr. Pan, Dr. Pan, really thank you for joining us. And then Dr. Joaquin Arambula as well from the Assembly's 31st District. I can never remember the district numbers, but glad it's on the screen. That really just also been some incredible wins in the last year or two that really advanced California to a place where the vision and dream that the stakeholder groups put out that feel more real, more achievable because of all of your leadership. So I'm going to take a seat, put them on the hot seat with a couple of questions, and then we'll go back and forth until we reach our time and hopefully get you to lunch on time. But with that, thank you for the privilege of a few minutes of your time, and let's get into it.
Let's do it.
So Melinda's first, and Melinda, I think first off, it would be great, I had the privilege, some of you have had the privilege of hearing how personal this whole movement and effort has been for you, what you shared about sort of taking care of your own family, and how meaningful this work is. And then also for BCSH, where do you see opportunities to advance on some of these important issues, in particular around the housing and homelessness issue where you and Secretary Lourdes Castro Ramirez have such an important leadership role?
No, thank you so much for the question, and it's just an honor to be here in general. It's great to see familiar faces and new faces, and Dr. Ghaly, you're right. This work is very personal. It's just not personal in housing, it's just not personal because of equity, it's just not personal because of homelessness, and it's not personal because of consumer protection. Because when I go home every night, I go home and I am a daughter, and I am a wife, and I am a mother, and I still have ownership and responsibility to take care and to hear from them as well. And in the midst of being assigned and being integrated into the Master Plan on Aging, which was so beautifully done, just because it took coordination to another level, and we'll of course get into that. But I have my mother and my father who have spent all of their life working and owning homes, and then there was a period in their life where that was not available to do. Brother number one couldn't help. Brother number two couldn't help. Brother number three couldn't help. A lone little sister who was barely purchasing her first home and trying to get enough savings, thanks to the first-time home buyer program, by the way, stepped up and leaned in a way I didn't know how. I had to talk to my parents about issues that they didn't really understand, how fast the financial movement was moving. They didn't understand what was happening inside their bodies. They didn't understand what was happening inside their mind, why they couldn't quite understand different things. And I said, you know what, rather than me get an apartment, I'm going to do all that I can to get into a home, and then you guys are going to move in with me. I moved my parents in, and it was like reverse psychology, because it was the best experience I had in really getting to know my parents. And it also gave me a whole new outlook into the fact that as you age, as many of us who are advocates and in that process of, is that it is very personal. And the purpose and impact and power of community and the responsibility as an individual to step up and to lean in, even for our loved ones. Calling and checking and reminding and helping and assisting and going to doctor's appointments and reading the small print so that they don't get scammed and making sure that they have a voice and making sure that parenting is not just about, them always being in control, but inviting them to be vulnerable so I can understand and help with the little bit that I can. And so when we started this process of talking about the master plan, I was like, oh my goodness. Now it makes sense because I didn't know how to articulate it and I didn't know how to integrate it. So yes, it was personal. It still is personal. My parents, they just moved back. Unfortunately, my dad has experience in a lot of health issues, but I am so glad that I started to lean in 6 years ago and been completely integrated into the process. They are still trying to find viable housing options. And so being that I'm from an agency that is prides half of its work into housing and homelessness, it's been an absolute honor to work through. So when we talk about opportunities, yes, Dr. Ghaly, you're absolutely right. That equity and ensuring that agencies and departments are embedding equity and recognizing that not everybody started from the same place. And not everyone's going to end up on the same place. And us being able to look at the current policies and programs with the equity lens and making sure that the actions, thank you, Dr. Ghaly, the actions will speak louder than the words is powerful, right? I think the major opportunity that we have, which I know has been brought up most of this morning probably, which is around the California Interagency Council on Homelessness, which Dr. Ghaly and our secretary co-chairs, that's a wonderful interagency council, but again, I'm going to use the word power because there's so much power in this room. The power of having 20 departments and agencies at the highest heights of leadership and partnership get together to leverage the existing work and practices that are going. We're all about new, but the existing work, the discipline, the accountability, the coordination to move in strength and numbers at a greater force towards one common goal, and recognizing that homelessness, of course, is widespread, but recognizing the plan, the action plan, the opportunity within the action plan to embed within the master plan on aging, making sure that we're very much lock in step, making sure that what we're doing on the left side and what we're doing on the right side actually moves in the right direction is an amazing amount of opportunity. There's a lot of programs set aside in housing that we already have through the MHP program where 20% is set aside just for senior projects. Lots of great success stories that we're seeing. We have housing as a climate strategy where we're thinking about like where the housing is, right? If it's in certain neighborhoods that may not be all open to having more housing, how are we fighting to remove the barriers, right? How are we thinking about making sure that housing is closer to hospitals, in schools, in services? That's a benefit to everyone, but particularly for seniors, right? Ensuring that that's integrated into that thought process and that implementation process is major. There's so much I want to say, but I guess I would just end with the fact that it's also really about when we think about the prioritization and the leadership from the governor and then the two agencies and a multitude of agencies that are looking at housing and homelessness as a priority. We've seen it with the historic investments in funding. We've seen it with the amount of progress that we're seeing with the plan. I talked about the action plan, but also the statewide housing plan. We're not just building to build. We're building strategically with goals in mind, with targets in mind, with making sure that a certain amount of those targets are absolutely affordable, or that making sure that they're geographically sound. There's a lot of information that is out there, a lot of data that we look at, interpret, and study to let us know. But more importantly, rather we're looking, since we're talking about opportunity, I just want to also flag the importance of being extremely people-centered. Thinking about the people in mind. We can look at graphics and policy and programs and procedures all day long, but thankfully, because of the leadership from the governor, and at least definitely from my secretary, Secretary Ghaly, and many hosts of others in this room, is to not forget about who is behind that number. If you say 20%, 30%, 40%, what does that mean? 40% of what, right? That takes a very concerted effort to take a step back to learn who is behind the number to ensure we never forget about the people who we're truly serving. So I'll stop there.
Thanks, Wynnelena. I'm going to give you a break, but we're going to come back to a few things about the Interagency Council, because I think it's a tremendous opportunity that I hope all of you know about and engage on. Senator Pan, you have been a leader on health issues in California for a long time. You have been one of the first who recognized years ago that we had a shift in the population coming. You asked, how are we prepared for that? And I think in many ways we've stepped up, but not in all the ways that we can. On healthcare in particular, you've challenged me and this administration, but many before. How are we going to afford this? How are we going to make sure that Californians can afford it? Not that just California can afford it, but that Californians can afford it. Your work with me on the Healthy California for All Commission, your work on just affordability in general, I think, is really been powerful, and you deserve a lot of credit for pushing us. But as you sort of approach this period where you'll be departing state leadership, continuing to lead, leadership does not come because you were elected, it comes because you care and you know how to bring people together around these issues. Both, what do you look forward to most in that next stage as you think about this movement, and what advice do you have for us as we try to keep the baton moving forward?
Well, thank you, Secretary Ghaly. And first of all, I just want to thank you for this opportunity to speak to all of you, and I want to congratulate you and thank you for your advocacy. It's so very important. It's interesting we have two pediatricians here, because usually people think of us being at the other end of the age spectrum, but I would make note that I think a lot of issues at the two ends of life come together, are somewhat similar. So they're not identical, but there's some similarities there. Before I begin, I also want to recognize, because I chair the Asian American Pacific Islander Caucus, two of my former colleagues, or predecessors, who were really champions on aging. And that was Senator Carol Liu in the Senate, and then Assemblymember Mariko Yamada, who chaired the Committee on Aging. And their work was very important in terms of legislative leadership, and I tried to at least fill somewhat their shoes in my service in the legislature as well when it came to aging. I think in my role as chair of the Budget Subcommittee on Health and Human Services, I remembered during some of our hearings, I asked about what's our plan for the aging population. In fact, we held an informational hearing on that issue, as I noted that particularly long-term services support, our AHSS program, as well as, of course, Medi-Cal funding for nursing homes and so forth, were a growing part of the state budget. And so the question was, as it was growing and growing and growing, and people were very worried about how quickly it was growing, well, what should be happening in those things? And in fact, in the informational hearing, we talked about the demographics. We had the Legislative Analyst's Office look at the demographics and so forth. And basically what came out of the hearing was that actually, interesting enough, as fast as they were growing, perhaps they weren't quite growing fast enough. Right? And when you're a budget person, you go, oh, okay, because I started in the legislature when we had $28 billion deficit in our state budget, right? And so when we looked at the demographic change, we said, assuming we don't change anything, now, of course, we want to be more efficient, more effective, more equity-centered, et cetera, and whether that takes more or less money over time and we become more efficient. But if we kept services the same, just on demographic changes alone, the state would need to have a 5% increase every year for essentially LTSS services, long-term services support. Now, 5% a year is faster than our GDP growth. It's faster than our state budget growth, depending on the year, right, et cetera. So, and I would point, I make note, because I've observed in the state budget that in each year that Governor Newsom has been in office, it's been roughly around that amount that's increased each year. However, I would also note that we've had, from a budgetary standpoint, relatively good economic, times, and that won't last forever. Unfortunately, I had that experience as well. So we do need to think about and plan for the future. And one of the things that I know that that's incorporated into the master plan for aging, we need to look at is how do we better support providing those LTSS, the long-term services and supports. Because right now, our current system is that most people can't afford it. Essentially, families have to spend down and then get enrolled in Medi-Cal, and then becomes a Medi-Cal budget issue, right? Where we can draw down some federal money and so forth. But that really isn't necessarily the best solution. And how can we better support middle-class families so that they don't have to spend down everything to end up on Medi-Cal? And in fact, I've authored some legislation in the past to try to look at this issue, but I think that is an issue and that we need to continue to crack. I appreciate Secretary Ghaly, you talked about our Healthy California for All, and one of the things we talked about was incorporating, so when we talk about, by the way, every time someone talks about healthcare financing, healthcare reform, they often leave out long-term services, support services, right? We need to consider that as part of healthcare. I mean, it's perhaps more than healthcare, but it needs to be incorporated as part of that, right? Thank you. So let's do our planning in that way. Right? We need to think about that. I know in our CalAIM process, the Medi-Cal reform, that is being built in, but it has to be larger than just Medi-Cal, of course, right? And so we have to think, so let's think bigger about this. I know there's some conversations with commercial health plans, et cetera, but we do need to create a path for the middle class to be able to better support LTSS service. By the way, it's not just for seniors, it's also for people with disabilities who are trapped in poverty because of requirements, financial requirements in order to receive LTSS services. So we definitely need to try to address that issue. I think that's perhaps as our population is aging, and I hate to say it, Californians, yes, we are getting older. So California, that is perhaps one of the bigger nuts we need to crack in terms of our budget, in terms of being able to deliver better services, and frankly, more equity as well. And we need to be sure that this is more available broadly. Now, that doesn't mean that that's the only issue, of course, right? And I think previous speaker has spoken eloquently about how this is really, in many ways, very personal. I mean, I have a parent who lives close by. There's a reason they're close by. So to be sure that if there's issues that come up, that I and my wife can help support my parent. So these are things that I think all of us are trying to figure out how to struggle with. I mean, my family's fairly well resourced, but even I feel the tension of that, and I can imagine that families that are less resourced certainly are feeling it a lot more. So we've got to figure out how to better build a more supportive society. I'd say argue a more multi-generational society. As someone's a pediatrician who generally has my career focused on kids, seniors are a resource. They're just not a burden. They're a resource for our community, right? So let's figure out how do we create that. I do just want to finally touch on, because I appreciate you mentioned, Secretary Ghaly, the governor's executive order on equity. And I really appreciate the partnership because I had a bill, SB 17. We were able to work together and put those things together into the governor's executive order, because I do think that we can't come with a solution that isn't equitable, all right? Equity is so important, and so I really appreciate the governor's leadership on that. I appreciate the governor's leadership on aging, because I know that when we first started in the legislature, I had brought up these issues actually prior to Governor Newsom, and to see the governor step up and then announce in his state address that he's going to try to address aging was so heartening, because that was no ding on our previous governors, but it seemed like the first time I heard a governor said, this is a priority for my administration, so really appreciate that. So with that, I think we have a lot of work to do, because great, we have a master plan. There's a lot of work to do on implementation, and I do look forward to, I don't think you have to be in the legislature, although I know that Dr. Rainbow will be, thankfully, another doctor. But I certainly look forward to continuing to working on these issues as a private citizen, and joining with all of you and holding the state accountable, and then also offering new ideas so that we can do better for our community and for our seniors. Thank you. Great.
Before I turn to you, Dr. Arambula, I'll just say we're missing one panelist. I think many of you are looking forward to hearing from one of our legislative leaders on issues of aging and disability, Assemblymember Nazarian. Interestingly, he and I both live in Los Angeles, and we often get on the same flight. And if I only knew that he was going to miss today's flight, I would have found some way to delay it, get up out of my seat, cause a little ruckus. But I know that he sorely misses being with all of you. This is an issue that each legislator, not all, but many legislators reach out to me to talk about various issues. And Assemblymember Nazarian was frequently reaching out about issues of aging and really wanting to push us farther, harder, deeper. And as he prepares to also leave his state legislature role, seeking potential leadership roles at a more local level, I was excited to put him on the spot on how do we translate the energy from the state to that local leadership level, hear from some of you later what that opportunity looks like. So hopefully you'll seek him out, share those ideas, and we'll have a chance to celebrate his achievements and contribution to the important work many of you are doing. And he's leaving one important thing that recently started, which is really a legislative caucus, both Senate and Assembly coming together. Our director, Susan DeMarois, had a chance to attend that conversation and hear from both senators and assembly members some of their ideas for how we lean in moving forward. So that's going to be an important group that continues to build, emerge, and it's his leadership that is helping make that possible. So even though he's not here, let's give him a round of applause for what he's done. So Assemblymember Dr. Arambula, thank you for joining us, and your leadership has also been critical. I want to personally thank you for the leadership. You leaned in a major way this last year to make sure we took the opportunity that was in front of us to extend care coverage to Californians who would have otherwise been overlooked for years to come, and your leadership there has been so critical. I wanted to ask you two questions, really. First, the importance of covering all Californians. What does that mean for this work here? And then secondly, you represent a very diverse community, the Central Valley, right? I don't mean to call it a single thing, but it's very different than urban, big coastal regions of the state, even different than the Sacramento region. And as you think about how different aging and disability issues are in the Central Valley, I want to hear from you sort of what you want all of us to be tuning into as we think about future leadership as well.
Thank you, Dr. Ghaly. And before I begin, I wanted to take a moment and appreciate Senator Dr. Pan, who I've had the honor and privilege of serving with for the last 6 years. If you can help me to thank him for his service. You know, it's important to recognize that we don't achieve or have these opportunities of success without partnership and collaboration. I'm grateful to be in rooms like this that have been planning for years on working on a master plan of aging. I'm going to focus my comments, if I can, on expanding access, on behavioral health, and on workforce. I'm going to begin, if I can, on what I saw firsthand. So while I'm not a pediatrician, I did spend 10 years working in an emergency room where I saw 50,000 patients firsthand. And what I saw was an injustice when certain segments of our community are unable to come out of the shadows and seek preventative care, to be able to access care as so many of us are privileged to be able to do. And what I saw was how segments of our community's lives are shortened, how they're unable to be able to live full, complete lives, to be grandmothers and grandfathers, to be participants in our community because they couldn't access care. And I'm grateful to the leadership of Secretary Ghaly and Governor Newsom in expanding health care to all elders regardless of immigration status, which went into effect May of this past year. We now have hundreds of thousands of Californians who have contributed to our communities, to our social fabric, to our economies, who we can now enroll into health care and get basic preventative care. Now, while we're doing that, I will say, having worked on the front lines where I realized I couldn't see my people alone, that there's needs for us to address workforce issues, particularly in areas like mine. You ask about the Central Valley, and we have half the number of doctors per capita as they do in LA and the Bay. We have a third of the number of psychiatrists to address growing behavioral health problems for our elders, our children, and those with disabilities. And we must invest into the workforce of tomorrow, as we know that burnout is occurring today to those who are providing needed care. And so I look forward to figuring out how we come up with those solutions, but we'll point to pathway programs, work that we've done with the administration to include into the budget, as was done last year with the Health Profession Career Opportunity Program. It was also in a bill we had introduced in 1306, but when it gets incorporated into the budget, what we're doing are providing pathways for communities who haven't historically participated in being providers to participate. We're being both culturally and linguistically competent by opening up doors to communities who have not been in these places before. Look, I'm the first Latino physician our state's ever elected to statewide office. What I know is I shouldn't be the last, and it's my responsibility to turn around and hold that door open for others. And so I appreciate that we've scaled and grown this Health Career Opportunity Program to create pathways for workforce of tomorrow. But know that we must address the shortages that we have within behavioral health and long-term supportive services, in workforce in general, to make sure that we're meeting the demand that our state will have over the next few years. I do want to point out, if I can, some of the disability work that my office and myself have been involved in. Specifically, I want to look towards the work on the DDS rate reform, which has been so needed after the Burns rate study in 2019. The fact that we're able to advance and move forward means we can address what we know are needed today. And yet that doesn't actually get us towards an equitable distribution of resources and opportunities, which is why we looked towards AB 1990 this last year to look on an ADA work group on how we can make improvements to the ADA and to have California continue to be a leader in this space. I will point to AB 1999, focused on behavioral health needs of those with low vision or who are blind, as well as AB 2480, looking at wraparound services, supportive services for those who are low and who are blind as well. I'll point to our work in the hearing aid for children's program and making sure that we extended services to those who have partial coverage, as well as making sure that we're doing all we can to provide for those within our disability community for actual justice. Right now, what we need to do is realize the struggle that we have within women's rights, within immigrants' rights, within workers' rights, is the same struggle that we have so often within our disability community. I look forward to partnering and advocating with the disability community this upcoming year to make sure that we're addressing the concerns that we hear. But I'll take a point of personal pride in addressing the purchase of services that are occurring in an inequitable fashion towards our Latino communities. What we know occurs with data is that those within our disability community who are Latino receive 2.5 times less resources than our Caucasian families with the same disabilities. What we know is that this is inequitable, that this is unfair, and that our communities need justice. They need champions and people like who are in this room to be able to stand up for all members of our community. I'm grateful that we have an administration who's listening to the concerns of all Californians and uplifting and being the change that we want to see, and that Senator Pan and I get to play a small role in helping to shape the budget that our state has for our communities. I'm grateful to be on this panel and to be able to bring these issues to you today.
Two minutes. I'm going to take 3. We're going to do 60 seconds of follow-up each, and you're going to help me hold you guys accountable. Melinda, first, you focused on housing appropriately, so our collaboration on the Interagency Council Homelessness. Today is about active listening for me, for us. How can we hear more about the housing issues facing seniors? What do you think is the invitation that you want everybody in this room to hear so that we do our job a little better than we would have otherwise?
No, thank you so much for the question, and the timer starts now. Okay, I'm going to lean in. 1, Sasha, raise your hand. Deputy Secretary of Housing, Sasha Kurgan. She's our expert. She came from the Department of Housing and Community Development. She has a passion and heart for the issues around housing, around vulnerable populations. You need to know her. If you don't, please get to know her. She is here and available for you if you want to know more. 2, I would also just say that when we do the call of action for help and for comment and for suggestions and feedback, please continue to lean in. If you haven't heard or seen from us in a while, please reach out. We want to know more. We want to continue to do more. I would say 3, Dr. Ghaly, to your question, and I'll just take the last 30 seconds to just really just talk about what I would like everyone to know. What's very extremely unique about the Business Consumer Services and Housing Agency, say that 5 times fast, 5 times, is that we don't look at housing just as housing. We're looking at housing as a continuum. We have the Department of Housing and Community Development, but we also have the Department of Real Estate. We also have our whole consumer division, right? That's talking about everything from our contractors all the way down to our doctors and our nurses. And so when we think about housing, we see it as a life cycle. And we are constantly connecting the dots just within the agency to get to solution. So I would just say that even though we are talking about housing within the stages of the master plan and everything else, is just to recall that we look at it holistically as the whole person, and that we just do the call of action to continue to be engaged and for the invitation to learn more. bcsh.ca.gov, Sasha Kurgan, and don't ever give up the cause. Thank you.
Dr. Pan, you and I have had many conversations about workforce, and Dr. Rambula, I appreciate you raising it. As we look at the changing workforce in both health and community-based services, home and community-based services, health services, we know that there's a dearth of providers, especially that are signing up to become geriatricians, to specialize in the needs of older Californians. What, if any, advice do you have to this room and us to really think about what that next chapter looks like?
Yeah. So first of all, of course, we need to build those pipelines, as Dr. Rambula said, and I'm proud that we've increased funding through the state budget for behavioral health workforce, for other primary care workforce, et cetera. There's also, we know it's a long pipeline, so you can't just churn out therapists instantly, right? They have to be well trained, et cetera. So we also got to think about how we make better use of the workforce we have. So for example, taking down barriers for primary care physicians and other primary care providers to provide basic mental health services, right? Also looking at how do we mobilize other forms of healthcare professionals as well to be able to provide some basic outreach. The other thing I also want to touch on, though, is because you asked in your first question, is in terms of affordability. We know for seniors, one of the biggest expenses is healthcare. And so So a couple things that I'm proud to have worked with the administration on. So one is we have the Office of Healthcare Affordability, but we also incorporated into that office in terms of setting those cost targets, the fact that we have demographic changes in the population. We don't want to just cap off what you spend, but it has to be adjusted to the needs of the population, to the needs of Californians. And so that was very important to me that we had that incorporated in there. The second thing is, of course, pharmaceutical costs, and proud to partner with the governor's office and you, Secretary Ghaly, on the state manufacturing generic medications, including insulin. Because that is really, it's not about the state manufacturing every generic medication, but it's sending a signal to that market saying that we will not allow certain types of, I guess, call them investors, hedge, et cetera, to basically try to corner a market on a medication and then basically profit off the backs of the illness of Californians and other people in the country. So we're going to work to be sure we address healthcare costs, but also we also need to address the workforce. It's interesting because we need a greater workforce, and we're talking about healthcare costs. We got to figure out how to do it smarter. We want to be sure we get people high value care. I mean, that's in the end what this is about, and we want to be sure that seniors are able to get the health care that they need. And so I look forward to continue to work on that issue out of office as well. But thank you. I want to thank Secretary Ghaly and the governor's office so much for the partnership on this the past several years. Thank you. You got it right.
Last question. Bring us home, Dr. Ambula. The housing, workforce, behavioral health, you touched on it. What do you think in the world of requesting from our stakeholders more information? What do you think we need to hear to really move the needle? We did a lot on children and youth behavioral health. We made historic investments. What comes next for older Californians in that space, and what do you think will help move us even further down the road?
Well, I'll start again just by appreciating the panel that we've been on, but also how far we've come. The fact that within our state budget, we've been able to lower the age of those who are seeking services from the Adult Protective Services from 65 to 60 allows us to get upstream, to be more preventative, to address the fraud and abuse that our communities are facing. The work that was done this past year on 1900 and 1995, addressing the Medi-Cal share of cost, allowing us to ditch the deductible that too many elders and seniors were facing, only occurs because of advocacy in rooms just like this, where we heard from community where our systems are not working effectively or fairly and how we can make changes occurs because you raise your voice and speak about it. And I'll end, if I can, on the work we did with Medi-Cal in eliminating premiums and co-payments, how far that will help our children, our pregnant women, those with disabilities, because we need to address the affordability that too many are focused and are facing right now. Now, I'm grateful that we have so many people who are willing to take their time, engage with government, and to have government make changes that are so necessary. We are grateful to be here in the great state of California, where we do have advocates who take that time. And I want to encourage you to continue to engage, to participate, and to have your voice heard. There are those of us who are in public service, who are listening and acting upon what we are hearing. I'm grateful to be on this panel with a bunch of those public servants here today.
Great. So, one last, just thank you, Assemblymember Rambula, Senator Pan, Undersecretary Grant, all of you for staying over just a couple minutes. I think Susan's going to tell you how lunch goes, and really just grateful for some of your time, and keep up the great work.
Our thanks to this panel. The title of this panel was Leadership and Partnership, and that was clearly on display. I can't think of 4 better examples than our panelists. Thank you so much for taking your time today and joining us. You now get a well-deserved break. We have lunch in the lobby area. We're having lunch here in the room. There might be a few tables in the lobby where you can enjoy your lunch. We will resume the program promptly at 1:10, so we invite you to be back at your seats by 1:10. I know that Ashton Applewhite's book is on sale in the lobby until 1 o'clock today, and box lunches can be brought back in, and we look forward to seeing you after the lunch break. Thank you all.